My name is Jean Trester. I'm an independent. My experience covers the time period 1959 to 2013. My sister Lois was under constant treatment from age 15 to 69 for schizoaffective disorder. She was treated in private university research facilities and Woodville State Hospital in Pennsylvania, Fort Logan Community Mental Health Center from 1969 to 1986, and then a nursing home in Commerce City. Challenges being worked through. The following statements about deceptions and half-truths may sound archaic, yet have insidious and enduring effects on how we respond to the seriously mentally ill. I have to abbreviate my written statement for time constraints. Please consider the statement, the mentally ill are not dangerous. A person experiencing psychosis who is ignored, denied treatment, is a threat to self and others. James Holmes, Matthew Rao, my sister Lois are examples. Lois spent extended visits home from Woodville with our family. Inevitably, her condition deteriorated. Police often transported her from our home to Woodville for the safety of the community and our family. The mentally ill as a whole and statistically are not dangerous. But people experiencing florid psychotic symptoms are capable of harming self and others. To deny this is deceitful and potentially catastrophic. Suggestions to make the system work for all Coloradoans. I endorse education, the early diagnosis and intervention for the seriously mentally ill. But I'm going to fast forward to number 4 on my statement. The majority of mentally ill are able to function in our communities. However, a segment of the seriously mentally ill will become gravely disabled. I would hope that we could provide care for them, possibly in nursing homes that house the mentally and the physically disabled. But we have some needed requirements. 1, vetted and educated volunteers will visit regularly with the patients. This will educate the public and decrease the patient's isolation. 2, the homes will be affiliated with a university medical system so that patients can be better evaluated and to promote research. Lois was once thought to have had a clot and stroke. She was placed on hospice. It was a misdiagnosis and the ensuing treatment deleterious and frightening. Also, Leiden factor 5, a clotting disorder, runs in our family, but there was no way to have this blood test for Lois, even when I offered to pay for it. After death, the Harvard Brain Tissue Resource Center examined Lois's brain and reported Parkinsonianism. I want to know whether this was the result of her medications or a result of Parkinson's disease, which runs in our family. Number 3, staff the homes with capable people who are fairly compensated. I have worked in a Medicare, Medicaid, for-profit nursing home. Certified nurse aides are vulnerable to abuse from management, in my opinion. Creates a toxic environment for all. Also, Had I been able to care for my sister, I would have. How could I have worked and been responsible for her too? I would have been dependent along with her. Lois never earned $1. Paradoxically, she was an economic engine. Many people earned a living because of her condition. I am grateful for the care. I am resentful. Frequently, she was hospitalized in acute care facilities. Lois was neither a person nor a schizophrenic. She was a dollar. CMS once paid for an operating room, and she had never been in an operating room. She once had a laparotomy, unnecessarily, and in my opinion, simply to make $1 for the facility. I wish the Behavioral Health Task Force success. May the mentally ill access quality care and function in our communities. May the public learn to love the seriously mentally ill the way I love my sister. Thank you. Questions?